Thanks to Jiz and to Sally for inviting me on the program. I wish I could join you live, but I'm in Greece, in Europe, and so I'm going to be making my contribution with a podcast. I think this podcast should begin with some sort of doom-laden, sinister music like in the Jaws movie, because the media hype about this new coronavirus suggests the world is coming to an end, that we're all going to be killed and wiped out by a very deadly disease. But let's look at the facts. The coronavirus actually has a very low mortality rate of 2%. That's just slightly higher than the seasonal flu at 1%. It's much, much lower than SARS at 10%. Most of the victims are elderly and they had underlying medical conditions. I think at this time of doing this, which is the latest data from February 3rd, is that there were just over 300 deaths in China, and the first death registered outside China in the Philippines. The second point is it isn't easy to catch. It's not easy to transmit between humans. There is very little evidence of the number of new cases being reported every single day. It seems to remain fairly constant. There's a slightly bigger jump this weekend, but early in the week there was a drop in numbers compared to the day before, I think on Wednesday. We're not seeing a sort of quadrupling or tenfold increase characteristic of an epidemic. Apparently the infection is lower down in the lung and not up in the higher throat and nose, and so people have to be very, very seriously ill before they infect others, and just standing 5 feet away is enough to avoid an infection. And thirdly, a promising cure has already been found. The Chinese have found that treating people with anti-HIV drugs is proving to be effective. And that brings me to a rather sinister episode. The World Health Organization declared the coronavirus a global emergency last week, and such a declaration allows for martial law measures and also for the use of very risky vaccines that don't need to be proven to be safe or effective. These can be given by force, and there are plans in place to vaccinate virtually the entire population of the world. A McKinsey business plan states as the goal of a WHO epidemic vaccine campaign the vaccination of the entire population of the world, which is now about 7.7 billion people. Now, the coronavirus is already in development. Vaccine is already being developed, and it's expected to be ready for human trials in just a few months. It's being rushed through in record speed, like the Ebola vaccine have been rushed through. Of particular concern is that WHO has declared 2 of these global epidemic emergencies simultaneously: coronavirus and Ebola. And both cases, for both diseases, vaccines being rushed through at record time. One of the Ebola vaccines already has a license in the USA and Europe under emergency rules. And very alarming is the evidence that it actually gives people Ebola. In some Lancet study makes it quite clear that people contracted Ebola as an adverse event from the Merck vaccine. That's a technical term, adverse event meaning side effect, and that contracting Ebola is the most common adverse event from the Merck vaccine. Results for the same trial were published 1.5 years later in December 2016 in the Lancet, and they were very different. But no satisfactory explanation is given by the authors why the results are so different in the December 2016 paper from the July 2015 Lancet paper. The only mention that Ebola is actually one of the main side effects of the vaccine is omitted. But it even has its problems. So a study by the National Academies of Science, Engineering and Medicine, Health and Medical Division published in June 2017, concluded that the trial data didn't show that the efficacy was proven, and that it could in reality be quite low, even zero, as the confidence limits around the unbiased estimate include zero, quote. And the study also found that no serologic data had been collected during the conduct of the trial, meaning that no immunological correlative protection from the vaccine can be determined. That, in simple language, means that the data which would have proved that the vaccine can protect against Ebola was not even collected as part of the trial data. Now, in October 2018, 2 years later, a Merck executive called Jakob Simon told America's Society of Tropical Medicine that the World Health Organization officials had told him they think the vaccine is effective, but the reality is that no one can yet be sure to what extent the vaccine campaign, compared with other health efforts, has helped end. The Merck vaccine is giving people. Ebola comes from the Palm study trial, where 155 of the Ebola patients of the 620 who've participated in this trial reported that they had had the Merck vaccine just shortly beforehand. So there's a lot of details to take in, but basically I encourage everybody to do the research, and they can see for themselves that this vaccine, there's a lot of evidence that this vaccine will give people Ebola. And this is just the first vaccine to be licensed. Johnson & Johnson's Ebola vaccine, it didn't go through clinical trials, but it's already been given in the DR Congo as part of a so-called strategy of prevention. That means that plan is to give it to entire regions, 100% of the population in an area. And the first phase of this plan is now underway in the DR Congo, targeting 750,000 people in the region. And UN soldiers and DR Congo soldiers are helping to carry out this campaign. The DR Congo Health Minister, Oli Lunga, resigned over the plan to use the Johnson & Johnson vaccine in July 2019 because he said there's no evidence it's safe or effective, and the population is very suspicious of all of these vaccines and believes they're giving people Ebola, he indicated. But it has been rammed through anyway. The Johnson & Johnson vaccine contains a cold chimp virus, and it's the same cold chimp virus was used in a Merck HIV vaccine, which was found to give people HIV, and the trial, called the STEP trial, was abandoned in phase 2, I think, when it was found out that men who had that particular cold were more likely to get HIV. But the Johnson & Johnson Ebola vaccine trial vaccine hasn't undergone people under the pretext of having to fight an emergency. Now, there are other, I think more than 10 other Ebola vaccines in the pipeline set to be approved. The Merck vaccine is already in production. We could be given it in the next few months even. And now we also have about floodgates have also been opened to these unrisky coronavirus vaccines under the global emergency. And so with 2 of these emergencies in place, we could be forced to take 2 very different vaccines. And that is, I think, very, very alarming indeed, and could be forced by soldiers and UN soldiers, as is happening in the DR Congo.